who has AF, and his journey to be able to self-manage that, get on the right medications, has been interesting, and maybe more interesting from my perspective as a health professional, thinking about how we enable people to do that. And he as a patient has been quite happy with all the things that have happened to him along the way, but actually it hasn't been the right thing, but he just doesn't know that because he's not in our system. I also I had a brother who died of AIDS when he was 31, and we've heard this morning actually that HIV now is more of a long-term condition than something that kills people. And why he was on a lot of treatment for HIV, and the cocktail of drugs made him sluggish, it made him not enjoy life, he saw his friends really, life was taken from them by the drugs they were on, and he made the decision, even at that age, that he didn't want to carry on with that cocktail of drugs, that his life really wasn't worth living. So I've got some very personal reasons, as we all have, for why this agenda is so important, and if we can get our personal passion behind this, I'm sure we can make this fly and overcome some of the barriers that I think we'll hear about this afternoon, but we can think about how we overcome those barriers in our own practice. So academic health science networks were formed in 2011 from the Treasury policy actually, which was called Innovation, Health and Wealth, and some of you might have seen this policy. And the government were quite frustrated about how long it took innovation to get into the health system. And they were quoting the statistic at the time that a new drug took 17 years actually to get to a patient by the time it had been for all its testing. So they wanted to spread evidence-based practice across the sector. They wanted to pull together complementary sectors, so they set up academic health science networks, which as the name suggests, we pull together universities, we've got 9 in our patch, healthcare, local authorities now and industry to make an impact on the lives of our residents through bringing new innovative treatments and drugs to bear. So they wanted us also to focus on how that impacts on the wealth of our region. So innovation, health and the wealth aspect was keeping people fit and healthy so they actually can go to work and they can contribute to the economy and have a better quality of life. But also asked us to look at how we support businesses in getting products into the NHS so that they can look at how they develop those things, how we work with them, and they can get their products through our procurement pathway, which isn't easy, so that residents benefit from those products. So that's what we do on a daily basis, or what we try to do. We cover Cheshire, Mersey, South Cumbria and Lancs, so quite a big region, and obviously lots of different cultures and ways of working within that region. But one of our roles is to look across the region, look at where we've got good pockets of good practice and help to spread that to people who are struggling or people who just want that extra push to get them into a good practice zone. So we work with lots and lots of partnerships. We have a board, and that board has 40 members on it who we hope are representative of lots of different organisations in our region that can help to push this agenda forward. So we've listed some partners on the slide, but as you can imagine, we have lots and lots of different partnerships. And if you're somebody in the room that thinks, well, I haven't really liaised with the Academic Health Science Network, come and see me or Tricia or any of the other staff and we'll link you in to what we're doing. So I'm going to go through a few achievements that I think are pertinent that we've had in 14-15. So the first one is our Innovation Scouts. And we realise that getting innovative approaches into organisations, it is about the culture. You can be somebody who's absolutely brilliant in an organisation, you've got products, you've got ideas, but you can't make them fly because of the culture in your organisation. So we have a network of what we call Innovation Scouts, so it's keen people who have been nominated by their exec team to come along to a programme to help them be resilient when they're trying to get innovation into an organisation. So they network together, they bring their good ideas, we get speakers in to help them from other sectors, they're going on a visit to 3M, so they're looking at companies who are innovative, and we're growing that network. We've got about 30 scouts at the moment, but we want to grow it out to other sectors. We do quite a lot of work internationally, and this afternoon you're going to hear from some international speakers from the Netherlands, our colleagues in Northern Ireland, some of our American colleagues, and we look for good practice internationally to bring into the region so we can accelerate our progress. But we also export our good practice, because I think we heard from Bruce Keogh this morning that actually our health system is good and we have lots of good practice, so we want to shout about our region and share good practice with others, so we do a lot of work in that space. We have a cross-cutting work theme that's about digital, And this is about accelerating self-management really, and accelerating sharing of data across the patch. So in all our work streams, we'll look for how we can incorporate digital means of delivering healthcare so that residents can self-manage where possible. And you'll see here I've just listed some funding that we've put into the digital work stream, and every year we've run what we call an infrastructure funding process where we've looked across the region and asked for people to apply for funding if they've got projects that they think will be taking the region forward over the next decade in terms of innovation. And we have put quite a lot of money into telehealth and telemedicine because of that. So we have a really wide-ranging campaign on stroke AF, and you'll have seen one of the examples this morning was on GRASP AF. And this is nothing to do with my husband. We started on this programme before I realised how serious AF was. So this is a programme that we were asked to run by local stakeholders because they realised that we had a big problem with non-detected AF across the region. So we've looked at some innovative technology solutions for AF. So we've sponsored LiveCore is one of those across a number of our CCGs to get diagnosis. We've run a programme with our strategic clinical networks and partners such as the Atrial Fibrillation Association, which is about early identification of AF. And then obviously the medicines optimisation part of this is getting the patient the right drugs in the right dose. So we've got a programme running around that, and Proteus are going to talk to you this afternoon about the application of their technology into that pathway. So we've tried to have a wide-ranging solution for this that cuts across lots of different pathways and brings lots of different stakeholders together. Precision medicine, which used to be called personalised medicine or stratified medicine, is also one of our big cross-cutting themes. So this is about the future of healthcare. Can we personalise treatment to an individual genome? So we've worked extensively across the region to be seen as a region that's at the forefront of this. We've got lots of academic expertise, and we've managed, obviously with a large range of partners, to pull the 100,000 genomes testing into Liverpool, working with partners in Chester and Lancashire to see if we can get ahead of the game for our patients because we can test them individually and treat them individually. So this is our plan on a page, which you'll see looks quite complex and busy. We've carried on some work themes from 2014-15 into 2015-16, and we also run the patient safety collaboratives for NHS England. So these are as a direct result of the Francis report, and it's looking at how we continually improve care across regions. So we're starting with a number of topics at the moment, scoping up the baseline so we can measure and monitor how we improve. And we're working with the other 14 AHSNs across England to look at good practice, look at who's already got pockets of good practice. And this morning we talked about medicines optimisation being led by Wessex AHSN. They've set up a cluster group so we can look at how we work together to accelerate progress. So I think I've gone through that medicines optimisation is a really important area of work for the AHSN. Trisha's going to talk to you a bit more about it, but just to plug for an event we've got tomorrow actually at the Liner. We've talked a bit about antibiotic prescribing this morning, and we have got a theme on infection. So we've got a whole day event here tomorrow that's looking at infection, looking at prescribing, which builds on what we've been doing today. So if you've got a free day tomorrow, which probably isn't the case in any of our diaries, but if you have and you're interested, see Trisha or one of the staff to put your name down. So this slide just summarises some of the things we're doing at a local level that are specifically around medicines optimisation. So we've talked about AF and stroke, very much based on the NICE guidance. We're doing some work around cancer, skin cancer. We've got a launch event with one of our companies in July to support the NICE guidelines. And in this region, we were asked specifically to do this by the Liverpool region because of the problems they have got with skin cancer across the patch. We're working with Edge Hill University, who are one of our most enthusiastic and flexible universities, on doing some online training for people around some of the patient safety collaboratives. We realise that people can't take time off work, so how can we do things in a bit of a different way to help them? We're also looking at care homes, a big issue across our region in terms of patient safety and medicines optimisation. So we've got a programme running on that. And I think now I shall hand over to Trisha. Trisha is our Programme Manager for Medicines Optimisation. A lot of you will know her, and she's going to go through some of the specifics about the programme.